Hello everyone, my name is Cynthia Alvarado Crawford and my group and I will be discussing how institutions' changes reconfigure successful value chains. I will be giving you a quick background on the Chinese pharma and I'll also be discussing the decision problem. Prince Baguette will be discussing the class concepts, Gohar Stepanyan will be discussing the three alternative solutions, and Ken Kelly will be going over our group's recommendations, implementations, and accountability plans. Let's get started. To give you some background in regards to the Chinese pharma markets, the Chinese pharma market became the world's third largest in 2010, and it was expected to continue to grow about 21.8% until the year 2013. Their market was limited when it came to foreign participation and resulted in the market being mostly made of domestic firms. China's healthcare system is primarily hospital-based, which accounts for 70 to 80% of the market's sales, with the remainder of their sales coming from retail pharmacies. China is working on further developing their healthcare system, and so there were three schemes health insurances created. The first one was the Urban Employee Basic Medical Insurance. The second one was the Urban Resident Basic Medical Insurance. And the third one was the New Rural Cooperative Medical Insurance. Their drug pricing and reimbursement systems are done through a hybrid model, which is regulated by the government. The overall study was done because Western pharma corporations needed to find a way to strategically adapt to China's pharmas. The Western pharmas looked at theoretical frameworks, such as institutional theories, the value chain concepts, and research framework in order to be able to identify any strategic shifts in the value chain. After the analysis, there were four shifts that were identified. The first shift was upgrading along the value chain. The second shift was outsourcing to contract service providers. The third shift was expansion of geographic scope. And the fourth shift was diversification of the product portfolio. The decision problem lies in how institutions have affected the value chain configuration of the Western pharma industry, and how China's transition towards a market-oriented system led to discontinuous changes. Instability in their institutional framework, which left the Western pharmas working towards change in China's institutional context as opposed to working towards having a strong and successful partnership as two different institutions working together to broaden their large markets domestically as well as internationally.
So the first thing I'm going to be talking about is competitive advantage, the local strategy versus the global strategy. Western pharmas have adopted a local strategy in China, which is to help cut costs on pharmaceuticals by setting up local manufacturing facilities and increasing research and development facilities based in China. That will help them cut costs on labor and put them in a location where logistically it just makes it more financially feasible in this emerging market. And just to go to Nissan Renault a little bit, Nissan Renault also found that same they also found that same market as an emerging market and a place where they could grow, along with some others as well. But for pharmaceuticals directly, it's big for pharmaceuticals. The next thing we're talking about is major tension in business strategy, which can either be research driven or market driven. In this case, for the Western farmers, it's market driven. And it's market driven because they're increasing the research and development facilities on site, as well as realigning the product portfolios to the requirements of the broader customer base of the Chinese market. So they're focusing on that market and expanding out within the Chinese market. So they're trying to hit this emerging market, and they're trying to figure out these particular customers, which are the middle class customers that they really want to go after. So huge business for the market driven business. Then I want to talk about Porter's framework, sources of strategic advantage for the Western pharma. There's three main sources that I'm gonna focus on is the value, cost, and focus, as you see on the slide. The value is an improving regulatory framework, the potential for them to attract a broad range of patients through reconfigured value propositions and a favorable factor market. Also the cost, an abundance of both animal resources and probands, as well as the availability of the scientific expertise and the medical infrastructure in China will help to reduce drug development costs and help to identify and grow within the research and development sector. The focus, in conjunction with China's economic development, this migration process enlarges Western pharmaceuticals' core target in the urban middle class that can afford these drugs, and it's just a huge growth opportunity. So as they start to expand and go out further into China, it gives us more room to grow. And again, Nissan Renault also did that in their strategy as they started growing in these emerging markets like China. Now I want to focus on the value chain hypothesis. So, and I'm gonna use the consistency view because that's what these Western farmers have really used in regards to finding their niche inside the China market. So first, starting with the cost leadership strategy. By setting up manufacturing and research and development facilities in China, they are able to cut costs associated with labor and product distribution. For differentiation, their differentiation strategy. By focusing on research and development within China based on their regulatory issues, as well as they could create branded products based on the local needs, that's a huge part for them to be able to differentiate themselves from some of the other suppliers. Focus strategy, we're expanding with China. We're targeting the middle class and we're expanding out throughout China in other areas, in the more middle class areas where we'll be able to sell and sell, push, and develop products. One of the last things I'm going to really talk about the blue ocean strategy. This is big. It's big for you being able to find and develop your niche so that you could have an open field for being able to sell and opportunities within the pharmaceutical industry. So there's four things we got to do. We got to reduce, we got to create, we got to raise, and we have to eliminate. So I'm going to talk a little bit about each one of those. We need to reduce rising pharmaceutical costs. That's what the customers want. That's one of the main objectives of us even being in China in the first place, that we need to reduce those costs. We need to create more research and development facilities to help develop more pharmaceuticals that can help save lives, especially within the Western farmers' ability in China to do more research because they have more access to animals, more access to other labs for them to do their research. In regards to raise, we need to raise pharmaceutical coverage. So, which can help us sell more premium, which will help us sell more drugs. So, and we need to step away and eliminate targeting just a premium customer base when it comes to premium drugs. So, huge opportunity here if we do it correct. I'm going to talk about the National Diamond Framework. The first thing we're going to talk about is factor conditions. The factor conditions are things that multinational corporations are attracted to, which gives them better conditions. So, for instance, in the China market, it's labor availability and so-called input factors. So, they have labor at low cost, and they're able to pretty much set up in an emerging market at the same time. So, demand conditions. The Chinese environment supports Western farmers to pursue this global shift, primarily because of the abundance of the animal resources and the probands. So they have the conditions there to be able to really grow in the Chinese environment. Relating and supporting industry. In China, they are high in research and development facilities, which can help support each other. There's already research out there for a lot of the local companies in China, and this is another huge opportunity for them to be able to grow. Strategy, structure, and rivals. It gives them sustained brand appraisal among Chinese consumers, and they get special price treatment. So this gives these Western corporations a chance to expand the life cycle of the original research drugs. So they have the strategy out there, they have the structure, they're able to build more research and development facilities as they intended to, and not only that, they could also increase their manufacturing. Of course, they're really looking to increase research and development, but it gives them opportunities across the board.
There are quite a few plausible alternative solutions that would result in success of the pharmaceutical companies in China. Due to strict enforcement of regulations of intellectual property rights, research and development is becoming a lucrative option. The problem is that there are increased costs associated with this. To offset the cost, these companies should continue investing in good R&D while partnering up with local companies to distribute and market their product. In other words, they would create the product and at the point of distribution use a sales representative who already sells locally manufactured blood pressure medication to sell the new company's cholesterol medication. After all, the target populations who would use the two medications often overlap, so you end up saving in marketing and in distribution. Another alternative is for the pharmaceutical companies to solidify their presence among the hospitals and prescribers. Since most of the pharmaceutical sales are to hospitals and not to individual pharmacies, the companies need to sponsor conferences at the hospitals for the staff. The companies can also offer seminars for prescribers to advance their skills. For instance, have a primary care physician who is going to treat skin conditions with the medications that the company sells, properly trained on the newest biopsy techniques and procedures. Advertise in medical literature or journals that are specifically targeted to the primary care providers, since this is the largest and the fastest growing part of medicine in China. Yet another solution is to market specific groups of medications to subgroups of pharmacies and prescribers who are more likely to be receptive to locally developed and manufactured quality medications. Because of the emergence of private insurance companies and medical system that is shifting towards utilization of many more private hospitals, I predict that there will be a new interest in some of these top-tier medications in China.
Our strategic recommendation is focused around collaboration with key players in the new market. As Western pharmaceuticals moves eastward, they need to understand the new marketplace from a legal, socioeconomic, political, and environmental standpoint, and who better to turn to than those who already operate within that realm. This collaboration will allow Western pharmaceutical companies to learn the values and culture of the market. It will help develop a network with local distributors, researchers, and other valuable resources. It will allow pharmaceutical companies to determine how to focus research, develop products that will sell in the new market, and how to make existing products sell. The company can then determine which products to offer and which to withhold, which to alter and which to leave unchanged, and what direction to move in both market research and product research. It is important to be adaptable, especially as the new market undergoes such significant shifts in intellectual property rights, modernization, and industrial revolution, and acceptance of Western versus Eastern ideals. Here, 2 points come to mind from Carlos Ghosn's interview in our coursework. Adaptability and the recognition of peripheral opportunities are absolutely critical, and a business operating in multiple markets has to allow for two different styles of operation. Integrate where feasible, but pay attention to local markets and don't make operations in two markets too similar. The implementation of this strategy will begin with the development of a network focusing on key players in the new market. See what direction these key players are going, learn from the ways they operate, and understand the differences in Eastern and Western medicine. This will be ongoing as the network will be utilized to optimize both supply and demand chains, understand competitor operations, and adapt to the market from inception to expansion. Next, with the assistance of the newly formed network, the companies will need to determine which existing products will sell as they are, which need to be tailored for the new market, and which will need to be kept out of the Eastern marketplace, and what original R&D is necessary. With the increased protection of intellectual property in the new market, a carefully developed network should be able to be trusted with some level of proprietary products for the sake of entering the new market successfully, and the current state of Chinese industry and production will allow for cheaper production and distribution of products. As laws, restrictions, and regulations begin to push Chinese industry in the direction of Western industry, an efficient distribution and production network and infrastructure will have already been established, and the Western pharmaceutical companies can focus on adapting and growing with the advancement of Chinese industry instead of always trailing behind the quickly developing market. Upon the establishment of new Chinese-Western partnerships, the network can be utilized to determine the feasibility of a product, and distribution channels can be evaluated to determine the best approach for product launch. The product can be tested in markets that are relevant to Chinese market research. After obtaining feedback, local partners can be consulted and the product can either be altered, launched, or removed from the market entirely. The success or failure of the product can be incorporated into current research and development tasks and/or ramped up for full-scale production and distribution, thus creating an infinite feedback loop to ensure the strategy remains adaptive. That concludes our presentation. Thank you.